problem, particularly predator fish. So we have to, there's no advisory saying at the lake saying don't eat the fish or only eat 4 per month. But this is here again another problem. Cancer, all the lupus, the rashes, the fibroid tumors, the endometriosis, the pelvic pain, the menstrual cramps, all a factor. So we're talking about, we're just about ending here, but Connie Tucker talked about in 2002 that children of color suffer from attention deficit disorders, hyperactivity, reduced learning due to homes and schools are located near or on toxic sites, cancer, lupus, respiratory illnesses, chromosomal damage. United Church of Christ, Justice and Witness talked about this. The President's Cancer Panel in April 2010 talked about it. And the IOM, the Institute of Medicine in New Orleans, about the golf spill, talks about almost everything that she mentioned in 2002. So we're talking about more recently, you saw on Wall Street, 7-year-olds, breast development. Blacks are 23%, Caucasians 10%, Hispanic 15%, 8-year-olds 50%, out of 1,228 young girls. Whites are 18%, Hispanics 33%, and it's related to obesity and environmental factors. So we're looking at unnecessary hysterectomies, endometriosis, fibroids, all of what we talked about, the health of minority women and their families, HIV, diabetes. Dr. Jones mentioned about the obesity problem. 80% of African American women in this country talked about being obese. We have to do something about that. The black male is another issue and concern. State of black position. We are looking at trying to enhance his position or her position so we can take care of more people. Meharry Medical College, along with Howard Medical College, and Morehouse was cited recently as given a tremendous plus as being the schools that met the mission, the social mission of educating what we really need, primary care doctors. They went number 1, 2, and 3. Meharry was number 1, Morehouse number 2, and Howard was number 3. This doctor is a doctor that has major issues, major problems, and it's just some of the things that's going through that we talked about. So we need to organize our organizations, as we mentioned, and that's what we will do. And lastly, how do we save our children, our future programs, religious programs that's needed by the community, black history, home economics, computer learning. So we need to, in essence, provide a means for our kids to have another life, a good life, in lieu of killing themselves and having troubles in learning about what they should learn about and not what they should be doing to hurt themselves. So with that, again, protect our communities. We need to clean it up, paint it up, fix it up, free it up from crime and drugs. And certainly together, ladies and gentlemen, we can make it better. And if we don't fight, we will get what we fight for. Next slide. Next slide. So in conclusion, healthcare reform is here, and we are thankful. It's not perfect, but one day, as we act to ameliorate it, we can say, at last.
Okay. This just shows we're paying more and getting less, higher percentage of GDP, higher per capita, higher as a nation than any other country, and we got the worst results, higher infant mortality, higher death due to preventable disease, lower life expectancy. So we're paying more, getting less. Next slide. Pre-existing conditions, you can't get insurance. Next slide. Those who have insurance aren't getting it. 14,000 Americans are losing their health insurance every day. 46 Americans already have no insurance, and it's getting worse. Next slide. We're already paying for the uninsured just because you have insurance. You can't disregard the uninsured. When you go to the emergency room and pay, you got to pay a little more because people who don't have insurance aren't paying anything. That's about $1,000 a year on the average family policy. Next slide. It's getting worse. Next slide. The wages have doubled where the inflation hasn't gone up much and wages haven't gone much at all. Next slide. It is consuming a higher portion of your income. Next slide. As a matter of fact, it used to be about 7% of income. It's about, right now, it's about 17% of income, and it's going to be, it's just going to eat up all your income by the time it's over. Next slide. This is what's going on generally, Medicare and Medicaid. All health care costs about 17% of GDP. If we keep going at the rate we're going, it's going to be about 50% of GDP. And from a budget perspective, we've got the budget. You got a problem with the budget? We don't have a problem with the budget. We can keep everything. If we can tax it about 21% of income, which we have from time to time done, we got everything covered except health care. Health care is a challenge. You get health care under control. As a matter of fact, that's how the Republicans balance their budget. They just eliminate Medicare. Go ahead. Okay, here's how health reform. First of all, if you're going to do anything, it's got to be comprehensive. You got to cover everybody, or you're not doing anything. If you can wait until you get sick before you buy insurance, everybody will wait until they get sick before they buy insurance, and everything will go out of control. We've described the plan already. Keep going. Keep going. We're going to be investing in wellness and prevention. Workforce investments, more money for National Health Service Corps, more money to train doctors and nurses, and invest in technology. There are benefits for those who have insurance. We've mentioned caps on out-of-pocket expenses, no lifetime limits on coverage, no rescission of benefits. There are going to be cost-sharing protections for anybody making under $88,000. Eliminate the donut hole. No discrimination next on pre-existing conditions. There's many of these go into effect right away. Benefits for small businesses. First, when people say small businesses are going broke when we do this, small businesses are exempt. Plus, they get tax credits. Senior citizens benefit by getting the donut hole and free preventive care. Those 55 to 65, before this thing hits in, will be getting tax credits to businesses to encourage them to cover early retirees. We have insurance regulation. Basically, if you got a little bit of cost control, not enough though, but an appellate process. It's paid for mostly by taxing unearned income like earned income in terms of the Medicare tax, and taking some corporate subsidies away from the Medicare part, Medicare Advantage. It's paid for, runs a surplus, extends Medicare. Okay, crossing state lines. If we just cross state lines, we can buy insurance. That's been studied. No more people. Gray is status quo. Green, if you let people buy across state lines, how many people will be insured? The light blue is how many people are insured. In fact, in the aggregate, any savings you get from crossing state lines is by virtue of the fact that you're buying a watered-down insurance policy, not because there's any cost savings or competition. My good friend has talked about the benefits of medical malpractice. As a trial lawyer, I just like equal time. Yellow is health care cost spending. Red is the amount of money paid in medical malpractice claims. There may be arguments for medical malpractice, but controlling health care costs ain't one of them. Next, as a matter of fact, if you want to figure out what to do about medical malpractice, red is the payouts. Green is what the insurance companies are charging you. You need to go after the insurance companies, not the trial lawyers. As a matter of fact, if you had a fair plan, the number of deaths due to the medical mistakes, 50 to 100,000. Number of medical malpractice death claims paid, about 5,000. If you had a fair practice, number total claims is about 15,000. If you had a fair practice, you'd be paying about 10 times more malpractice claims than you're paying now, because most claims can't be paid because it can't be brought because it's just too complicated. We passed not a Democratic plan, but a Republican plan. That's a little secret about this. Democratic plan was a single payer or watered down public option. What we passed was the Nixon plan, the Chafee plan, the Mitt Romney plan, the Dole, Daschle, Baker plan, or the Wyden-Biden bipartisan plan. All of them have mandates. All of them have employer mandates and subsidies and all that. If they're so apoplectic about this plan, they ought to go after the one in Massachusetts. So that's one of the things we have not done is control costs, and that's the next step. And that's going to be ugly. You couldn't do both access and cost at the same time. One of the things Marvetta mentioned was the fact that some of the what we call is a woodwork effect. when you have somebody who might go into a nursing home, it's a lot cheaper